So this is our NGO. It is called Mana'a. Mana'a standing for immunity, and it is the name is the charity organization caring for HIV patients in Riyadh. This is the old name. It has been changed, and I'll tell you why it was changed. So the we don't have time for that. Okay. The objective, the goals was public education about mode of transmission and how to avoid the infection, and defending people living with HIV and their families' rights and supporting them to regain their humanitarian, civil, social, and legal rights. For the objective, public education through campaigns from all facilities, fighting the stigma and discrimination by passing the true information and correcting the myth. This will reduce the stigma. Communication with the lawmakers and NGOs to create and enforce laws protecting people living with HIV rights, enforcing the knowledge that the infection could be avoided, mainly through personal behavior. And that's what we are talking about now, 98% sex and drug. So taking protective measures will reduce the infection. So what have we achieved during these 10 years? We visited the governor of Riyadh, and we get his support for our campaign, and he endorsed that. And we went to the religious leader, we call it Mufti in Saudi Arabia, and we told him frankly that we are dealing with people with HIV, people who had adultery, who had illegal sex, and people who are injecting drugs. And we are here to help them and help the society to protect themselves. And we get all the endorsement from his side, to the extent that we are authorized to collect funds from the religious areas. And we work with the local, we went to the human rights organization in Saudi about 10 years back, and we drafted a law that will protect the people living with HIV, their rights, everything in that regards. It was about 32 items, and it went through all aspects and finalized. It was approved about 2 years back. This addressed everything: their right to work, their right for treatment. Somebody said that the patient was pulled out of the OR, that doctor will be actually by law will be penalized. So they are entitled for all civil rights for everything. They are to be employed in all sectors except military and healthcare service. And if they are diagnosed to be positive while at work, they are not to be fired. They have to modify their job. So it addressed everything. However, also it addressed their responsibilities and their commitment to protect the society. And also it encourage education in the society, how by spreading the information, teaching the youth how to protect themselves and avoid that. And the message we are trying to pass is not, don't practice sex. One of our colleagues said abstinence. There is nothing called abstinence. They do work, okay? We have to acknowledge that people are indulging in extramarital sex. We like it or we don't like it. Our job as healthcare workers is to teach them how to protect themselves. Use condoms. If you are taking a drug, don't share needles. And again, that's what we said this morning. Healthcare workers or practitioners, we people, we think that the authorities are against talking about these things. This is not true. This is absolutely not true. As I told you, we talked in the media. We went to the religious leadership and they supported us. We went to the Ministry of Interior in Saudi Arabia, and we asked them to license or to allow us to distribute needles in the pockets of drug users. And they said, okay, you are free to do whatever you want. So the authorities in our region, actually they are supporting these things, but they cannot do it. They cannot do it. It is very volatile political area. And people are accused this government is doing things against religion, this doing that. So, but the NGOs have open free hand to do whatever they want. This is the law. So again, I'm here trying to encourage all our colleagues in every part of the area. Try to create NGOs, volunteers, people who are willing to work and to help, and I'm sure we can change a lot of things. Thank you very much.